We've heard a lot of concerns about the current availability of inpatient services for people's mental health in England. For some people, unfortunately, stays in hospital become protracted and prolonged. In some parts of our system, people can spend years in an inpatient bed. That's sometimes because their needs are very complex and they need a lot of support. In others, it's because there are delays going home. Anna, you led the work doing the research. What did you find about people's experiences of inpatient care today?
A lot came through around how to reduce trauma, particularly with people with complex needs, autism, and learning disabilities. When they are in those psychiatric environments, it can be even more traumatizing, and their behavior can equally be misunderstood. So we also heard quite a few people who hadn't been diagnosed or had maybe been misdiagnosed. So those complexities weren't known. Um, Routines might have changed unexpectedly. That's then going to be very triggering for people, or the environment is triggering. But equally, the behaviours of other distressed patients around them can be incredibly traumatizing. Um, we heard of instances of mimicking, but also that sort of PTSD as a result of actually being in psychiatric hospitals.
It was really powerful, wasn't it, to hear from people who'd experienced being in hospital, either as a patient or indeed people working in hospitals and family members. And it's clear that while a lot of people got good care and care that was helpful to them, many more had experienced quite traumatic things. What should a good system look like? Where would we see the balance? It's not necessarily about more beds or less beds. It's about how inpatient services fit alongside other things, isn't it?
The key messages that were coming through was around that sort of therapeutic, person-centered approach, early intervention, and really supporting and investing in those community services as well, including the voluntary sector.
In terms of the kind of places where you get mental health care, I know we've looked at examples of things like crisis houses or different kind of community supports. Are there examples you can give us of the kind of things we think could be part of the system in the future alongside existing inpatient services?
Birmingham Think Forward did a brilliant passport for their young people, which, seems like quite a simple tool, but actually having to re-communicate your situation can be really traumatic for people. We came up with open access community and citizenship models. So that's the Trieste model, Hope Services in Surrey, they've come up a lot. And theirs is very much a sort of open door approach, non-coercive, in and out, sort of really building people as citizens.
In achieving this vision, this isn't about taking money out of one service and putting it in another. This is about investing properly in those alternatives to inpatient care so that we can take the pressure off the inpatient system as it is now.